Let's talk about the benefits of vitamin D that your doctor may have overlooked. This is something that a lot of women don't know. So I'm going to talk about vitamin D as it relates to your vagina. Yes, your vagina. I am Robin-Nutritionist, and I help women over 40 use food and nutrition to build our bodies so that we thrive and mitigate symptoms and concerns related to hormonal balances. And I talk a lot about vitamin D, and I'm going to tell you why and all of the things that vitamin D can do for you, including supporting your vaginal health. Vitamin D is so powerful for our bodies, and I really want to help you and me reduce our dependency on medication. Vitamin D is an easy deficiency to have, an easy deficiency not to have, and it does wonders in your body. All right, let's talk about what it does for the vagina or the Uchi, whatever you call her. Tell me what you call her. You can put it in the comments. So, one of the things that it does is it helps with lubrication. As we get older, she has the tendency to try to dry out, and vitamin D supports vaginal dryness. That's one of the things. It also helps our cellular health down there, which we need. We need healthy cell regeneration, and it also helps with our pH down there. So it's just take your vitamin D, all right, for the sake of your lady part. Here are also another list of things that vitamin D supports you in. Some people think that it's just for bones, and it's not. It helps you with your mood, your gut, inflammation, blood pressure, blood sugar. It helps to prevent certain cancers, fibroid growth. What didn't I say? I said, did I say blood pressure? I said blood sugar, fat metabolism. I mean, the list goes on. Easy deficiency to have and an easy deficiency not to have. And if you have melanated skin, getting it from the sun and having it absorb is even more challenging. When you go to the doctor, hear me when I say, because not all doctors are going to check your vitamin D, and I don't know why. I just had an experience. So when I was in California, no problem. Vitamin D checks were a part of my regular physical. Now that I have relocated to the East Coast, I had to request it, and then I got a little bit of pushback. And then I was sent an extra bill outside of, I pay for insurance, but I was sent a bill because vitamin D is not a standard part of the physical. Be that as it may, I needed to know what my vitamin D levels are so that I can be empowered. And I just want to encourage you to make sure that you get your test because it can save you on so many levels. I have so many testimonies of clients and customers and what vitamin D has helped them with. I didn't even mention your hair. Vitamin helps your hair growth and your hair follicles. Listen, just get it. You get it from the sun, but most of us are not getting enough. And food, you really don't eat enough food to move the needle. It truly comes from the sun, and then there's the supplementation. So it's nothing to play around with. I've seen so many cases where women had issues going on. They would go to the doctor, they would get medication. No one could figure out what was going on, and it was related to a vitamin D deficiency. Oh, also autoimmune. Vitamin D helps to suppress and just it helps with autoimmune disease. Okay, just understand me when I say I'm super passionate about it, and I just want you guys to understand the power of vitamin D and make sure that your doctor checks you. And what do you want your levels to be? That's another thing. If you're at 30, you're going to be considered okay. That's not therapeutic. That's like minimum wage. You can maybe live off of minimum wage, but you're not thriving. So if your vitamin D is at 30, if it's in the 30s, the 40s, you're okay, but you're not thriving. The therapeutic range that your body is maximally supported is between 60 and 80. That's where you want your vitamin D to range, between 60 and 80. And if it's not in that level, then you want to up level your vitamin D. Now, if you're below 30, then you are deficient. And that's where all kinds of issues can come in. So make sure you're not deficient because you know what your numbers are. Make sure that your range is between 60 and 80. It is so beneficial. If you're a woman over 40, listen, there's no reason to not take your vitamin D. It is the number one supplement for us in perimenopause and menopause, for sure. Make sure you're taking it with K2. K2 helps to get the calcium actually that's in your blood into your bones, away from your arteries. It helps it absorb better. That is why I wholeheartedly promote or recommend D3 with K2, unless you're on dialysis or taking a blood thinner. That's when the K2, you want to check with your doctor on that. But all things being equal, and I know you're wanting to know, how much should I take? Because I don't know you, and maybe, well, I might know you. If you're in part of my community, send me a message and we'll talk about it. But for all things being equal and I don't know you, then I personally take 5,000 IUs a day. But what I recommend, if you have no idea where your levels are, then start with about 2,500 of D3K2. And there is a formula for that. I'll perhaps link the video to the formula or the video that I explained how you can kind of calculate what your vitamin D will be. But we would love, Necessary Nutrition would love to be your supplier, if we're not already, of your vitamin D3, your magnesium, and your plant-based protein. That's what we focus on when it comes to supplementations, because those are the ones that women in our age range, those are the top ones that we need the most. All right. So take your vitamin D daily for your vaginal health, for your bone health, your skin. I don't even think I said that. It touches so many systems in our body. And when one thing is thrown off, it throws off another. And then you go to the doctor with an ache, a pain, a something, and then they want to give you a medication. Take your vitamin D. All right. So like, subscribe, share this video. If it helped you, leave me a comment. I'll absolutely reply. And that's all I want to say about that. This is Robin-Nutritionist from Necessary Nutrition, and I'll talk to you soon. Peace and blessings. Take care.